I'm stronger and faster than I was when I had leukemia.
It was just about 2.5 years ago in September of 2011 when I first met Lily and her parents. Lily was an excited little girl ready to go to school, but she wasn't feeling well.
Lily was getting reoccurring fevers, and at the same time you said that your legs were what, Lily?
Wobbly.
Wobbly.
And at that time, we confirmed that her blood counts were very abnormal, and in fact we diagnosed her with acute lymphoblastic leukemia.
The diagnosis was devastating because we didn't know what it really meant. But luckily the people here at Mass General, they answered all our questions and got us on a protocol right away. Just meeting all the doctors and the nurses, it felt like a family, and right off the bat we felt like these were the people who were going to give us the best care.
MGH Pediatric Oncology Clinic was one of the best in the country, and of course then when we found out that Dr. Weinstein was going to be your doctor, we didn't even second guess the decision to stay at MGH.
I was never afraid to come to the clinic. No. I always enjoyed coming to the clinic. I would always ask, when's our next clinic visit?
When she comes to clinic, it's very clear that she's here. Everyone knows Lily's here. She's always running around, dancing, singing. She seeks out our child life specialist, is always looking forward to actually coming to clinic, which is amazing.
He's a doctor that mostly no other doctors can be. He's a doctor and he's funny at the same time.
Oh, yeah.
So he's a good doctor. He ran the marathon. He always comes into my room every time I'm here at the clinic to get like blood work or anything else like medicine. He always comes in and says hi. And says how you doing, and asks me a couple of questions, and then I answer them like, how's school going?
So he cares a lot about you?
He always checks in.
Each year when I run the marathon to raise funds for our childhood cancer program at the Mass General Hospital for Children, I run for one of my patients. And I did not have any difficulty deciding one year who I was going to run for. It was going to be Lily. Lily just got to my heart very, very quickly from the get-go. We had a really fantastic relationship, and she was so inspiring and so energetic. I thought, that's just what I need to, complete my marathon this year and help me with raising awareness for our program. And I knew also that seeing Lily's bright smile when she came to clinic would be something that I would sort of carry with me as I ran the 26.2 miles. And in fact, that's exactly what happened. So the mile 20 point in the marathon is always very emotional for me. My patient partner will be there, as well as family and friends. And when I ran for Lily, she was at mile 20 with her parents. And when I got to mile 20, and I was feeling okay, but not wonderful. And there was Lily and her family, and Lily jumped up, gave me a big hug. I could barely hold her. It was just so moving and so emotional that I just suddenly felt full of energy and was ready to go for the last 6 miles. It was perfect. Lily's face would be right there, and I would, take the next step, and knew that I would get to Boston.